Welcome, folks. It's been a long time. Of late, I've been studying diabetes, and in that study, I'm focusing at present on hypoglycemia. Very interesting. Absolutely very interesting. And I want to leave no stone uncovered. Some of the things I want to set forth as objectives to know what hypoglycemia is, to know how the body maintains euglycemia, healthy blood levels of glucose, to know what people are at risk for a hypoglycemic episode. From the get-go, I want to tell you some yellow flags and red flags. Any patient who's on exogenous insulin or patients taking sulfonylureas or meglitinides, PO, by mouth, that stimulate the production of insulin or secretion of insulin from the beta cells in the pancreas. These are triggers that, if not used wisely and carefully, can trigger a hypoglycemic episode. We want to know how to properly intervene in the presence of a hypoglycemic episode. So much so that the plan will be fixed in our mind, what we'll do next, what we'll do next. And also, what about post-hypoglycemic episode? Strategies on being sure to avoid this in the future. One hypoglycemic episode is a strong predictor of another one. So it needs to be nipped in the bud. That's going to take skillful intervention and wise clinical judgment. There was a time when I was a nursing assistant back in the early 80s where a patient on the ward, he was with his wife. He was in bed and his wife was visiting. And all of a sudden, the wife alerted us because the patient was tremulous and shaking and whatnot. And the RN came in and she seemed hesitant. Fortunately, there was an intern in this learning hospital named Dr. Wong. He was walking by and we called him in. He looked at the patient in a calm manner and he said, "Are you a diabetic?" And the patient said yes. And then he asked, "Is there some D50?" And he gave it to him, IV, and lo and behold, it was like there was peace. Like the waves suddenly became still. I learned a lot from that. That doctor, who later became intern of the year, and I could see why, what he knew led him to respond properly and effectively in a potentially dangerous situation. We know that a hypoglycemic episode can spin way out of control with the outcome of death. So it's something we want to be very knowledgeable about. And we know that there are millions of patients on exogenous insulin. By the way, exogenous, outside source. And patients on sulfonylureas. So this is valuable information. And my plan here, and my hope, is that this is the beginning of a journey of understanding hypoglycemia in detail, no stone unturned. What my resources are: some by personal experience. I took care of my mom who had hypoglycemic episodes. I took care of patients as an RN who had hypoglycemic episodes, at least one I can remember. I love to read and study, and the internet has been a wonderful, wonderful thing. And there's so much information. I've been able to look into Harrison's Book of Medicine. That's been a great resource. There is myriads of hypoglycemic PowerPoint slides. I'm able to somehow get some of the protocols of hospitals, how they're dealing with the problem of hypoglycemia. Listen to podcasts and a host of other things. You might say, I have caught a wave with a surfboard. Curiosity and a deep, deep longing to understand what it's all about. So this is the beginning of a journey. And Lord willing, there'll be slides and videos to follow, and we'll learn together. Listen, it's good to be back. Thank you.